Okay, so today we're going to go over how to take a manual blood pressure as well as other vital signs, but we'll start with manual BP. Colleen has helpfully volunteered to have her blood pressure taken on camera. So for your manual blood pressure, the different parts of it are the sphygmomanometer, and on yours with the kit at home, it's the same idea, it's just a lot smaller of a dial so that it fits into the kit. And then you have the tubing attached to the cuff itself. There are many different sizes of cuffs. This is just another example. There's pediatric cuffs, tiny cuffs for babies. So how you know which cuff to choose for your patient is you want to take the width of the cuff and you want it to be about 40% of the diameter of the person's arm. So it's kind of a rough estimate of that. It's never going to be perfect, but you just kind of want to guesstimate as best you can. And then you have the bulb and the dial here. You'll also need your stethoscope for this, so have that ready to go. So to start, we're going to want to palpate the patient's brachial artery, which is usually a little bit medial of the antecubital fossa area. And I can feel it nice and strong there. And it helps if the person actually hyperextends their elbow. So for a couple different reasons, we've asked Colleen to put her elbow on this pillow. One, it raises it up to be a little more at heart level. And then two, it's more comfortable for her, hopefully. And then it also kind of helps to hyperextend that elbow, so it kind of exposes that pulse a little bit more. So we want to find that pulse right away because that's going to help us with the placement of our cuff. And you'll see on the cuff it has this artery index. So these arrows is where you're going to place the cuff about 2.5 centimeters up from there. So we'll open up our cuff and we'll place it there. It kind of helps to tuck that tubing underneath, get it out of the way. So a couple centimeters just above that brachial artery where we palpated it. And you want to make sure the cuff is wrapped smooth with no bends or folds as best you can. So with the bulb, there's this dial on top. When you turn it clockwise, so all the way clockwise, you'll feel it eventually meets resistance and it locks. That means that the cuff is ready to be inflated, that it's locked. And you'll hear it start to inflate and you'll see your dial start to climb up. And to release that pressure, it's counterclockwise, so you can loosen it. And we'll go over when you want to do both those things. So to start, it's helpful to ask your patient if they know their baseline blood pressure. And we'll sort of pretend that Colleen doesn't know her baseline blood pressure for today, because oftentimes that will be the situation that you encounter. Maybe you don't have a baseline, it's a new patient, or they're unsure of their baseline, or it's not recorded. So to kind of go start from scratch, you don't know their baseline. So there's a couple different ways of doing this. There's the one-step method sort of and a two-step method. But basically, to estimate her systolic blood pressure, we'll palpate that brachial artery. And you can feel it bounding, so you want to make sure you can really feel it. You're going to make sure you're closed here, so you've gone all the way clockwise, because we're going to inflate. So we're going to inflate that cuff until we can no longer feel her brachial pulsation. So at about 110, I obliterated her pulse. So at about 110, if her pulse was obliterated, that means we're going to go up to about 130 or 140, because we're going to go 20 to 30 above that to account for any error there. So you want to palpate and inflate your cuff until you can no longer feel their pulse, and then you're going to go 20 or 30 above that when you're actually listening with your stethoscope. So if you do it in that way where you're going to pump it up first and palpate and then release the pressure to loosen the cuff like I did there, maybe you could hear it releasing and you can see the dial dropping. Give the person about a minute of a rest there, because you've now inflated the cuff quite a bit, and you're going to do it again and sort of slowly deflate it, so you don't want to hurt them or injure anything. So if you're doing that one-step method, just give them a bit of a break. There is a way to do this and sort of combine the steps. And how I like to do it is put in my stethoscope first, and I'm going to, so I've palpated the brachial artery, and you can sort of do it have your stethoscope ready to go. You're not going to hear anything. I just have it nearby and it's in my ears. And now I'm going to pump up, and I'll just sort of talk through it. I'm going to pump up until I can't feel it anymore. And then I'm going to pump up to that 20 or 30 beyond that point. And then I'm going to just replace my fingers with my stethoscope. And this is where I'm going to start to slowly release the pressure and listen for the sounds. And I'll go over that listening now too. So if we did it that way, and we go to 20 or 30 above where we last felt that pulse, and then replace our fingers with our stethoscope, what is going to happen is you won't hear anything, and then suddenly you will start hearing pulsations. And where you start hearing those pulsations come in, they usually come in pretty loud, like goosh, goosh, goosh. That's where that is indicating her systolic blood pressure. So where you hear that first sound is indicative of the systolic blood pressure, and then you sort of hear that sound, it changes just a little bit and you hear it throughout. When you hear that sound disappear, that is her diastolic blood pressure. That one I find is a little bit trickier because I think most people can really obviously hear that sound come in, but when it goes away, you really want to make note of where that sound goes away or disappears, because that is the diastolic. In children, the diastolic is actually just where that sound gets muffled or changes, but in an adult, it's when that sound disappears. So those are the two sounds you're actually going to be listening for. So we're going to go ahead and go up to about 140 for you, because we're going to go 30 above. I'm going to have my stethoscope ready to go there, or I can place it now because I know the estimated systolic. So I'm going to want to close my valve here all the way clockwise, and we're going to pump up. And we're going to slowly release it. And we're listening very carefully here. Good. Thanks, Colleen. And I got about 118 on 80, which is an excellent blood pressure. And that's close to your baseline, maybe slightly elevated because of the circumstances. So then you want to remove the cuff, give the person a bit of a break. I've obviously turned her arm a bit red through that process. And you clean your machine, or if it's a single patient one, that's okay. And that's the basics of doing the manual blood pressure. So you can compare with the other arm as well. It's not a bad idea. So you just kind of adjust your positioning. And the key thing with this is to practice, because those sounds are really hard to hear to an untrained ear, especially at first. So you want to get really good at noticing them, and you're definitely multitasking. You're watching and you're sort of getting really good at using that valve and slowly undoing it, and also watching and listening at the same time very carefully. So good thing to practice lots. It's hard to get on the first try, but just practice lots and you should get it. So we'll move on to the other vitals now.